Medicare Patrol Project of the District of Columbia kickoff, sponsored by the AARP Foundation and the Friendship House Association. As Denny said, I'm Margaret Dixon, immediate past president of AARP and honorary chair of the Medicare Patrol Project. In the next 30 minutes, we'll hear from local and national leaders, district ward spokespersons, health and aging advocates, and Medicare heroes about identifying and reporting Medicare fraud, waste, and abuse. You'll also see AARP's award-winning Medicare fraud public service announcement, specifically adapted for the district. The national version will be shown in Spanish and Chinese. In addition, you'll learn that physicians are key players in the fight against Medicare fraud, waste, and abuse. Most physicians are honest, caring providers who want to be the first to hear your Medicare billing concerns. But unscrupulous individuals cost Medicare billions of dollars annually, and we need to weed them out. A recent study by AARP indicates that about 80% of Medicare recipients in the district believe there is waste, fraud, and abuse within the system. The study also shows that most recipients would do something about it if they knew what to do. We'll show you what you can do to help preserve our Medicare funds for ourselves and for future recipients. Our campaign goal is to educate the 77,000 Medicare recipients in D.C. about identifying and reporting Medicare fraud, waste, and abuse. We will be presenting 26 events over the next 4 months so that everyone gets the word. Join AARP Foundation and Friendship House as we unite and fight Medicare fraud in the District of Columbia. Mayor Williams is already on board. We have received a proclamation from the mayor's office proclaiming today as Senior Medicare Patrol Day in Washington, D.C. Now that we know why we're here, I'd like to introduce our first speaker. We welcome the Secretary of Health and Human Services, Donna Shalala, who joins us by videotape.
Hello, I'm Donna Shalala, Secretary of Health and Human Services. I can't be with you today, but I want you to know that your message, Unite and Fight, is my message too. Unite seniors throughout the district to fight Medicare fraud, waste, and abuse. Keeping Medicare strong is a promise we must never break. Although most healthcare providers are honest, trustworthy, and responsible, a few bad apples just want to get rich off Medicare. That hurts everyone, which is why we need local programs like the Senior Medicare Patrol Project of the District of Columbia to supplement our national campaign, Who Pays, You Pay. From day one, we've proved that when it comes to fighting fraud, we mean business. We've investigated fraud with the latest crime-fighting tools. We've put more than $1 billion back in the hands of taxpayers. And most important, we've recruited the best army of fraud fighters this nation has ever seen. I'm talking, of course, about America's seniors. You are on the front lines, catching fraud and unintended mistakes. You're our eyes and ears. So call, and we'll respond. Tell us what we can do better, and we will. Thank you.
Our thanks to Secretary Shalala for her message and for her continued support in the fight against Medicare fraud, waste, and abuse. Next, we'll view the English version of the award-winning public service announcement, Who Pays, You Pay, AARP's national campaign against Medicare fraud.
A small annoyance left unattended can lead to bigger problems. like the little cheat you may find on your Medicare statement. Billing for services not provided, unnecessary goods and services, double billing. Medicare fraud and abuse waste billions. Who pays? You pay. If you see something questionable, fight back.
Join the AARP Foundation and the Friendship House Association. Unite and fight Medicare fraud in the District of Columbia. For more information, call our hotline.
The PSA is wonderful, but we are the ones who must carry the message to our communities. So now, please welcome Mimi Castaldi, AARP State Director for Washington, D.C.
AARP members are volunteering their time to help preserve Medicare for themselves and their children. Trained volunteers, Medicare recipients themselves, will spread out across the district to teach beneficiaries how to identify questionable charges, from simple mistakes and billing errors to outright fraud. The Senior Medicare Patrol Project has already scheduled 26 community presentations. But in order to reach the 77,000 Medicare beneficiaries in the District of Columbia, we need your help too. Please consider joining AARP and Friendship House volunteers in this effort to protect Medicare. If you're interested, just stop at any of the information desks on the way out and somebody can help you learn how to sign up. Thank you.
Our next speaker, Don Hentz, is the CEO of Friendship House Association, the co-sponsor of this event. Don?
We're now in our 97th year of serving this community, but serving seniors has always been a principal objective of Friendship House. The Senior Medicare Patrol Project of the District of Columbia allows us to continue this worthwhile goal from a different perspective. Friendship House Association and the AARP Foundation have joined forces to educate the senior citizens of the district on how to identify and report questionable charges on your Medicare summary notice. A powerful tool in our fight against Medicare fraud, waste, and abuse is our hotline. The hotline operates from 9 a.m. to 5 p.m. Monday through Friday, Eastern Time. English, Spanish, and Chinese language representatives are available to assist you. It is easy to use the hotline through the three-step plan set forth in this Unite and Fight Medicare Fraud in the District of Columbia brochure that you have. For example, if you spot a questionable charge on your bill, first call your health care provider. Most health care providers are honest and trustworthy. The questionable charge may be a simple mistake or clerical error. Second, if you still have questions, call your Medicare carrier for an explanation or clarification. Third, if you're still not satisfied, call the Senior Medicare Patrol Project hotline at area code 202-434-2099. Again, that number is area code 202-434-2099. Be assured we will take your call seriously, whether it involves a simple mistake or outright fraud. Finally, remember, it is important to prevent fraud before it happens. Treat your Medicare card like any other credit card, and do not give away your Medicare number for free goods or services. Such promises can be scams and should be reported immediately. Remember, we need your help to improve the efficiency and quality of Medicare services and ensure that Medicare dollars are spent on you, the united beneficiaries of the District of Columbia. Thank you so much.
Thank you, Don, for that very important information. Now we're going to hear from Ms. Margaret Parker, who is a Medicare fraud hero from New York.
Thank you, sir. Good morning. I'm Margaret Parker from Brooklyn, New York. People call me a Medicare fraud hero, but I'm just an ordinary citizen. Shall I repeat?
Yes, please. Speak right up.
Good morning. I'm Margaret Parker from Brooklyn, New York. People call me a Medicare fraud hero, but I'm just an ordinary citizen who did the right thing. Honesty is very important to me. So years ago, when I received Medicare summary statements with charges for equipment that was never ordered, like a hospital bed and a wheelchair, I just had to do something. Okay. I called the Medicare fraud number listed on my notice, and an investigator came to interview me. I was later asked if I would testify in court, and readily agreed to do so. Shortly before the trial, I was informed that my Medicare number had been used fraudulently by a doctor in the Bronx. I personally had never met a dishonest doctor before, and as people like that man, they make it hard for all the honest, upright doctors we have in our country. The investigation and subsequent trial led to criminal convictions. I was glad that I did my part to get money back for the Medicare system, to be used properly for beneficiaries like you and me. Medicare is a wonderful program, and we cannot afford to take it for granted. Thank you.
And thank you, Ms. Parker, for sharing your story. Now we're going to hear from Cheryl Williams, who is a representative of Congresswoman Eleanor Holmes Norton of the District of Columbia. Cheryl?
I'm on the legislative staff of Congresswoman Eleanor Holmes Norton. I'm going to read a statement that she prepared in light of the fact that she's not able to attend. I enthusiastically applaud the work of the Senior Medicare Patrol Project of the District of Columbia to engage all the partners in combating Medicare fraud, waste, and abuse. I deeply regret that congressional business necessitates my preparing for a bill on its way to the House floor and makes it impossible for me to be with you this morning. I am engaged with other members in a major fight to add a prescription drug benefit to Medicare at a time when seniors in the city have resorted to choosing between food and medicine or to less than prescribed doses because of the enormous cost of prescription drugs today. Our seniors are paying more than twice what preferred customers pay out of pocket for prescription drugs. We will not be able to get this indispensable benefit added to Medicare if the figures continue to roll in about overpayments and fraudulent practices. We need citizens to patrol their own health care costs so as to guarantee that seniors get what Congress has appropriated to them and them alone. Your self-help efforts, such as the efforts of Margaret Parker, to detect fraud and abuse on the front lines will help me in Congress in the fight to preserve Medicare and to add a life and health-saving prescription drug benefit. Thank you.
Some of us have been victims of deceptive billing practices and didn't know where to turn. Our next speaker, Dr. Joseph Gutierrez, President of the Medical Society of the District of Columbia, reminds us that we should first turn to our doctor or health care provider when unusual charges appear on our statements. Dr. Gutierrez?
On behalf of every doctor, your doctors, and the Medical Society of the District of Columbia, I'm pleased to be here to support this community-wide effort. Now, some of you might be surprised to see a doctor up here, given that we are here to address a problem that makes us all, physicians and patients alike, very uncomfortable. But if you're surprised to see me here, please consider two very important facts. Fact number one, we all know that the vast majority of physicians are honest and deserving of the trust placed in them. Fact number two, probably more than anyone else, doctors want to eliminate any fraud, waste, or abuse in Medicare. As they say, one bad apple spoils the whole barrel. If any doctor is even perceived to be acting improperly, then it's bad for Medicare, It's bad for you, our patients, and it's bad for the profession of medicine, which I and many others have devoted our lives to build. So I am here to urge you to follow the three-step plan set forth in the Unite and Fight booklet. And although each step is important, I ask you to focus especially on step number 2. If you have any questions about your Medicare statement, contact your doctor first. The problem may stem from a simple clerical error or a misunderstanding. Don't be afraid to ask questions. It is in everyone's best interest that you and your doctor communicate openly and freely. Thank you.
Thank you, Dr. Gutierrez. Now we'll hear from the spokespersons representing the district's 8 wards. We begin with Ms. Lydia Perez, representing Ward 1.
La zona 1 está localizada en el cuadrante del noroeste desde la avenida Massachusetts y Park Place en el noroeste. Nuestra zona tiene una población de 69,000. Nuestra zona tiene una población de 69,889. Aproximadamente el 16% son de 55 años de edad o más. Nuestros constituyentes representan una cultura diversa de muchos países de mayor edad. Por el hecho que estamos mayor y consideramos que este proyecto tiene mucha importancia e impacto, nosotros en la zona 1 estamos involucrados en este proyecto tan valioso. Nuestra zona se une a la lucha contra el fraude del Medicare el miércoles mayo 17, 2000, con una reunión que se llevará a cabo en el Centro de Personas de la Tercera Edad de Fula, 1844 Columbia Road, Northwest C1, Washington, D.C., 2009. Y ahora tengo el placer inmenso de presentarles a nuestro orador, Mr. Jade Palm, de la zona 2.
大家好。在第2区呢，在第2行政区大概有7万的人口，那其中呢有大概1/5是55岁以上的老人的人家。我想在这个第2区里面有一个特色呢，就是亚裔的人口我们是第2行政区的一个特色因为语言还有文化上的差异，我们常常成为医疗照顾保险的那个受害者所以我们非常愿意也非常高兴来支持今天这个会议。我们在5月11号在亚裔服务中心会举行一个特别为这个反对医疗照顾保险诈骗计划的这个会议我们也希望大家来参加谢谢 Thank you. Now it's my pleasure to introduce the spokesperson from Ward 3, Mr. Don Meyer.
Thank you, Mr. Payne. I speak for Ward 3, which is located in the northwest quadrant of the district from Canal Road to Beach Drive. Ward 3 has a population of 69,000, of which 1/4 are 55 years or older. This sizable contingent of older people is well aware of the need for honest management of Medicare funds, and we will all welcome the tax savings gained from the elimination of Medicare fraud. Ward 3 joins in the fight against Medicare fraud in a rally on April the 13th at St. Mary's Court, 725 24th Street, Northwest. It is now my privilege to introduce the spokesperson from Ward 4, Ms. Willie Williams.
Good morning. Ward 4 has a population of 66 people, which 30% are 55 of age and older. Our community comes from a diverse background. We welcome the opportunity to participate in a senior Medicare patrol project. On April the 27th, 2000, we will host a Medicare fraud rally at 504 Kennedy Street Northwest.
You've just heard from the spokespersons of the district's first 4 wards. Now we're going to hear from Ms. Veronica Pace, the Executive Director of the D.C. Office on Aging, who is well aware of the issues our older citizens encounter. But before we hear from Ms. Pace, let's view the national PSA in Spanish.
Una pequeña incomodidad, si no se le presta atención, puede convertirse en un gran problema, como las pequeñas estafas que aparezcan en su estado de cuenta de Medicare, cuentas por servicios no prestados, bienes y servicios que no son necesarios, factura doble. ¿Quién paga? Usted paga. Si ve algo que esté dudoso, trate de combatirlo. Llame al 1-800-447-TIPS.
I'm Veronica Pace, Executive Director of the D.C. Office on Aging. As the Executive Director, I am the chief advocate for the 94,000 senior citizens in the District of Columbia who are 60 years of age and over. We join our partners, the AARP Foundation and the Friendship House Association, in working to eliminate Medicaid fraud and abuse. And we will work to make sure that the 45,000 older persons who are participants in our programs in every ward of the city, from wards 1 to 8, indeed know what Medicare fraud can do and its relationship to higher medical costs. I do this in partnership with our mayor, Mayor Anthony Williams, who could not be here today, but sends you his pledge and commitment to work to eliminate Medicaid fraud, waste, and abuse, because he is a can-do mayor. But he is also fortunate in another way, because we have another advocate in the presence of the mayor's mother, who imbued him with the can-do spirit. And it is now an honor to introduce the mayor's mother, the first mother of the District of Columbia, who will partner with us to reduce Medicaid fraud and abuse, Mrs. Virginia Williams.
Good morning. I'm Virginia Hayes Williams, the mother of Anthony Williams, and I'm proud and honored to be here. Anthony joins me in knowing the importance of Medicare and the need to prevent Medicare fraud. As a member of the Medicare generation, I am critically aware of the threat posed by Medicaid fraud. And the fact is, tens of thousands of senior citizens in the District of Columbia depend on this program for their health coverage. We truly need to work together to protect our program against waste, fraud, and abuse. It is very reassuring to know that we are well represented by AARP Foundation and Friendship House Association. I commend the AARP Foundation and Friendship House Association for their leadership in protecting our benefits and their foresight in sponsoring the Senior Medicare Patrol Project of the District of Columbia. But we must all do our part. This Unite and Fight Medicare Fraud in the District of Columbia brochure outlines the three-step plans for preventing fraud, waste, and abuse. I encourage all of our citizens to read this Medicare summary and notice carefully and follow the steps detailed in the brochure. Working together is the key. Working together, we can help protect the Medicare trust for current and future generations. On behalf of my son and myself, I thank you for every effort you make to protect our future from Medicare fraud. Thank you so very much.
Thank you, Mother Williams. Yes, this will be a citywide effort. We will all unite to fight. And another spokesperson who joins in the partnership is Valerie Caldwell, who represents Ward 5.
Good morning, everyone. My name is Valerie Caldwell, and I'm here to represent Ward 5. Ward 5 consists of northeast and northwest. We have a population of 63,169 residents. Imagine all those votes. Approximately 29% of them are 55 years of age and older. Our consistency comes from a large, diversified background, of which presents economic and health challenges. The latter being the reason why we are here today. We are here to join in the battle against Medicaid fraud. On May the 9th, 2000, there will be a rally at St. Mary's Church, located at 1140 North Capitol Street, Northwest. That's at Sibley Plaza. Now, it is my pleasure to present to you the spokesperson for Ward 6, Dr. Ernest Postel.
Good morning and praise the Lord, everyone.
Praise the Lord.
Let's turn to each other and say, we're going to fight Medicare fraud. Talk to each other. And we're going to do it today. You know, Ward 6 there on Capitol Hill, which I'm also the commissioner. But first of all, I want to say, give thanks to my good friend, Congressional Norton, representative, and also Mrs. Williams, the mayor's mother, and so my good friend Veronica Pace, also the agent, and also Don from the Friendship House. And also my good friend sitting over there, Miss Brenda Renda. I can't have to say anything about her. Good morning, once again. You know, on behalf of the AARP and the Friendship House, I'm certainly pleased to be a part of this initiative. You know, in Ward 6, we have a diverse community, and with all different backgrounds, and also population of older Americans. That's what we have in Ward 6. And I assure you that in every day come, they got a good fighter there on Capitol Hill. And that person is Commissioner Postel. And we're going to fight fraud here in the District of Columbia. And we're going to do it today. With all our friendship and all our going to doing, and you senior citizen there, we're going to work for you. We're going to work for you today and tomorrow and the next day until we wipe out fraud here in the District of Columbia. And for further doing that, we're going to give you Mr. Grisby. Mr. Grisby, you come forward.
Good morning. Project Keen is the lead agency of the District of Columbia's Office on Aging. Our service area includes Ward 6C, 7, and 7. Both areas are exclusively east of the Anacostia River and covers areas in southeast and north and the northeast quadrants of the District of Columbia. According to the 1990 census, the combined population of persons 60 years or older in wards 6C and 7 is 14,600. Our constituency comes from diverse social, cultural, and economic backgrounds. We are committed to participate in this worthwhile initiative, fighting Medicare fraud. It impacts all of us and should be eradicated. This issue will be addressed repeatedly to our senior membership at the congregate and homebound locations, to family, caregivers, and community advocates. Thank you. It is now my pleasure to introduce the spokesperson from Ward 8, Ms. Josephine Ward.
I can't outdo the gentleman who was sitting beside me for Ward 6, but his boundary line runs right in front of my house. But we are doing an excellent fight in Southeast. As you know, we're east of the river, and we're in the paper continually all the time. And it's bounded by a quadrant of the district from a bridge called Welch Memorial Bridge and the Southeast Freeway. So I want you to tell you, I'm learning that part of the name, Marbury Point, but I'm still looking for where it is. But it's something that we are interested in, and we are becoming awakened to the things that are happening to the far southeast. We have a population out there of 60,926 people. 50% of them or more, 15% are 55 years or older. And so that means we have a lot of people that we are reaching now, have to reach in the future. So we are trying to have at least 4 to 5 centers in the far southeast that will take care of educating our people, and you all will send representatives to us so they will know. And we're supporting everything that you have by this rally of Medicaid fraud, because I didn't realize until I retired that there was such a thing as Medicaid fraud. But after you started hearing complaints and all from all over the city and all, I said, well, I'd best get busy and find out just what it is. And so when the Senior Citizen Counseling Service said we're going to have a workshop on Medicaid fraud, and that's going to be, let me catch the right address on that. That's got 2451 Good Hope Road, and we're going to have a rally on April the 25th at 10:30 in the morning. And then we're going over to the Rehoboth Baptist Church. We're going to the Senior Citizen Counseling and the Knox Hill Senior Dwellings on Jasper Street, and we're going to the Claiborne Center on 2600 block of 30 of Martin Luther King. So you see, there are a lot of centers that are really starting up. And I think if you give us at least a couple of more months, everyone in Southeast will know Medicare. And I wish to thank Mr. Grisby.
Now that you've heard from all of our ward representatives, I'd like to welcome U.S. Attorney Wilma Lewis. With Ms. Lewis is our second Medicare fraud hero, Mr. Charles Kelston.
Medicare fraud has such a far-reaching and devastating impact upon our health care system that helping to stop fraud and abuse in our Medicare program is critically important. In this regard, the AARP Foundation and Friendship House Association are to be commended and applauded for the great work that they are doing to unite the beneficiaries of the District of Columbia in the fight against Medicare fraud, waste, and abuse. It is important to remember that most health care providers are honest and committed to billing patient care and services properly. However, the relatively few that engage in improper activities are taking advantage of our healthcare system, They're costing us billions of precious dollars, and they're putting programs like Medicare in jeopardy. The Attorney General has made detection and elimination of health care fraud and abuse a top priority for the Department of Justice. A national health care and abuse control program has been established that is designed to coordinate federal, state, and local law enforcement activities with respect to health care fraud, waste, and abuse. Such collaboration is bringing much needed and powerful criminal and civil enforcement tools and financial resources to the fight against health care fraud. As a result, over the last few years, the number of health care fraud criminal prosecutions has risen dramatically. In fact, federal prosecutors filed 371 indictments in health care fraud cases in 1999, a 16% increase over the previous year. We have also seen a steep increase in the number of lawsuits filed by the government to recover Medicare dollars improperly expended. Last year, monies recovered through these suits allowed the government to return nearly $369 million to the Medicare Trust Fund. Here in the District of Columbia, over $9 million was recovered in 1999 as a result of overpayments in the Medicare program. But law enforcement efforts against Medicare fraud and abuse can never be successful without the participation of Medicare beneficiaries. It is a beneficiary who knows what medical services he or she has received and therefore is in the best position to detect if Medicare was billed for services not actually performed. One such beneficiary who made a real contribution to our efforts to protect Medicare from fraud is Mr. Charles Kelston from New Jersey. He is a Medicare hero who I am very pleased to introduce to you at this time.
I realized that Medicare fraud was a big deal 6 years ago. As a volunteer in Essex County, New Jersey, I was helping Medicare recipients to fill out their forms when I suspected fraud and decided to do something about it. What I learned is that every beneficiary should ask themselves 3 questions when a Medicare statement arrives. 1, did I get the service or product that Medicare is being billed for? 2, did my doctor order the service or product for me? And 3, to the best of my knowledge, is this service or product relevant to my diagnosis or treatment? If you answer no to any of these 3 questions, then you should promptly call your doctor and get some answers. It may be simple billing error, or a mistake, or maybe fraud in action. The Medicare fraud I reported took several years to resolve, but when the lab associated with this fraud had to return $500,000 to the Medicare Trust Fund, I knew it was worth it. Thank you.
In the United States Attorney's Office here in the District of Columbia, we have appointed both a criminal and civil health care fraud coordinator. These individuals work closely with other law enforcement agencies to ensure that our efforts are effectively targeting wrongdoers. But I will reiterate, an effective health care fraud enforcement program takes active participation not only by law enforcement and prosecutors, but by the healthcare community and beneficiaries as well. Working together, we can make a difference. Yes, let us unite and fight. Thank you for your interest in helping us in this very important fight against fraud and abuse. Thank you.
We appreciate your reminders of the questions we need to ask when we suspect Medicare fraud. Now we're joined by Brian Lutz, Director of the Administration on Aging's Anti-Fraud, Waste, and Abuse Activities, which is funding the Senior Medicare Patrol Project. Brian?
Good morning, everyone. On behalf of Jeanette Takamura, the U.S. Assistant Secretary for Aging, thank you for coming here today to join us in this noble mission. You are helping us to safeguard the health care received by older, poor, or disabled Americans. We at the Administration on Aging are very proud of the Senior Medicare Patrol projects across the country. Over the past 2 years, they've combined to train more than 16,000 volunteers, such as yourselves, to be Medicare and Medicaid resources in their communities. And these 16,000, in turn, have educated hundreds of thousands of beneficiaries how to take an active role in protecting their care. Today, through the exceptional efforts of the AARP Foundation and the Friendship House Association, we're expanding these volunteer efforts to the District of Columbia. We also have projects operating in Maryland and Virginia. And by July 1st of this year, we hope to have projects operating in every state in the country. I'd like to commend our friends at AARP Foundation and the Friendship House Association for your leadership and commitment to making sure that every Medicare dollar is spent appropriately. We look forward to working with all of you to safeguard health care for everyone in our community, regardless of age. Through your active involvement and with the participation of hundreds of thousands of other Americans across the country, we have a tremendous opportunity to stop this problem right now. Thank you very much.
Thank you, Brian Lutz. George Grobe, the Department of Health and Human Services Deputy Inspector General for Evaluation and Inspections, is also with us this morning. George.
The Office of Inspector General is charged to protect programs of the Department of Health and Human Services from fraud, waste, and abuse, and also to promote economy and efficiency of their operations. We're all very proud of what all of us have been doing. In addition to the $369 million that Attorney Lewis mentioned was returned to the Medicare program last year, we also succeeded in excluding 2,976 individuals from participating in that program who were abusing it. Now, Medicare is a huge program, and it provides lots of opportunities for fraud, waste, and abuse. Our traditional approach of audits, investigations, and inspections has been pretty effective, but we can't do it alone. As Secretary Shalala has said, the beneficiaries are our eyes and ears. To this end, our department, along with the Department of Justice and AARP, together launched a campaign in February of 1999 to educate beneficiaries and their families about preventing, detecting, and reporting Medicare fraud, waste, and abuse. Now, we heartily welcome the Senior Medicare Patrol Project of the District of Columbia and the district beneficiaries as they join in the fight against Medicare fraud. We look forward to hearing about their successes. Thank you. And now, it's my pleasure to introduce the previously shown public service announcement in Chinese.
你可能发现你的老人医疗保险 Medicare 报告单上有假的账目，如虚报账目、提供不必要的医疗用品和服务和重复收费等。这些欺骗和滥用所造成的损失高达数十亿美元。谁付这些钱呢？就是你。如果你发现报告单上有可疑之处，请拨反欺诈热线电话，电话号码是1-800-447-8477。
Our goal is to spread the word to the district's Medicare beneficiaries, ideally in the language that they speak and understand best. The district can be a unified front in the fight against Medicare fraud. Now we welcome Angela Bryce-Smith, Branch Chief for Program Oversight in the Program Integrity Group of the Healthcare Finance Administration, which we call HCFA.
Today, nearly 40 million Americans rely on Medicare, and we will pay out more than $210 billion for their health care this year. The private insurance companies who are Medicare contractors will process almost 1 billion claims from 1 million providers, hospitals, suppliers, and other kinds of health care providers. It is truly an enormous task, and we need your help. As taxpayers and Medicare beneficiaries, you can help us prevent everything from simple billing errors to outright fraud. At the same time, we want you to know that those of us who run Medicare are doing our part to protect the program. We've toughened our standards for businesses to care for Medicare beneficiaries. We've clarified rules and how to build the program. We've conducted more medical reviews and audited more claims. And we've seen results. In the past 3 years, we've cut Medicare's improper payments sharply, but more must be done. That is why the Senior Medicare Patrol Project here in the district is so important. As Medicare beneficiaries, you are our eyes and ears in the fight to end waste and abuse. Most doctors and hospitals and other providers are honest, and they share our commitment to stopping fraud. They work hard to provide quality care and to bill appropriately. By reviewing your Medicare statements, you can help Medicare, your doctors, hospitals, and other providers fix simple mistakes, honest mistakes very quickly. And you can help us identify the relatively few unscrupulous providers or people who help rip off or are ripping off the Medicare program. After all, who pays for those wasted dollars? You pay as taxpayers and beneficiaries. The money that we save will help keep Medicare strong for you, your children, and all other Americans. Thank you.
We are about to close. You've been just an absolutely wonderful audience, and we appreciate your presence and your support. But as we close, let's remember that Medicare is the nation's only guaranteed health protection plan. To preserve and strengthen Medicare, we must do our part in preventing fraud, waste, and abuse. As you've heard earlier in this program, carefully examine your Medicare summary notice. Contact your physician if you have questionable charges or services or products. These could be simple errors, clerical errors, or they could be oversight. Most doctors are honest and they have your interests at heart. But if you're not quite satisfied, contact your Medicare carrier. And if you still have unanswered questions, call the Senior Medicare Patrol Hotline, as Don Hentz told you, and I'm going to repeat the number, 202-434-2099. Again, I want to thank all of you for joining us this morning. Beneficiaries, please turn in your completed evaluation forms and your headsets at the booths on the outside that have the large Medicare summary notice in English, Spanish, or Chinese. You will also receive your personal fraud fighter t-shirts and information kits at the booths as you leave. And if you're hungry, you haven't had breakfast, there may still be refreshments outside. Thank you again, all of you, and remember that Medicare is a benefit for you. Join the AARP Foundation and Friendship House Association as we together fight Medicare fraud in the District of Columbia. Thank you, all of you.